Assalamu alaikum. Today in this video we are going to discuss the role of the kidney in the control of the arterial pressure. This is a very important topic regarding the control of the blood pressure of our body. Our body blood pressure that is regulated by not only the heart but also by the arteries, veins, and have a very important role from the kidney side also, and through many hormones. A role of brain is also there. So all these structures which are mentioned in this animation, they are going to participate in the control of the blood pressure. Among these, we have discussed how the vasoconstriction or vasodilatation occur and some of the hormones also. Today in this video, we will discuss the role of the kidney in much more detail. This is the same picture regarding the control of the blood pressure. Blood pressure, which is the product of the cardiac output multiplied by the peripheral resistance, and affected by not only the humoral factors but also have the role of the kidney and the neural factors also. They are going to participate in the control of the blood pressure. In previous video, I have already told you that blood pressure is one of the topic which requires much more detailed, thorough discussion through many lectures, and many organs, many hormones, they are going to control the blood pressure of our body. Many organs, they are affected by the high or low blood pressure, and it is a thing which is affected not only by the cardiac output but also by the peripheral resistance, but also because of the effect of the venous return and many factors other, including the genetic factors, including the diet. I have already mentioned all these things, but today the main thing that is the role of the kidney. Again, I will suggest that that is a very vast topic. I cannot cover this in one lecture. Again, it needs many lectures, and you will study this thing in more detail, in much more depth in second year also, while discussing the renal unit. So it is not the end. You just say that it will be the just the introduction about the role of the kidney. One thing. Secondly, it is so much complex. I will try to give you a comprehensive understanding about that and about this topic, but it is so much complex that I cannot explain completely, as it is beyond your level. And in the second year, we will discuss the all aspects how the kidney is going to participate in the control of the blood pressure. But at this stage, I want to give you one more advice, that this topic, this chapter is very important, and it is very much thoroughly written in your textbook. I would suggest that you should study this topic from the mini guidon, because in mini guidon they are just focus the important points and they elaborate these mechanisms mainly, so that you cannot lose your attention. While in the big guidon, there is much more detailed examples, so that it is you may lose your attention, you may lose your concentration. But I suggest that you should read this topic, this whole chapter, from the mini guidance, because in that it is they are focusing main mechanisms which are related to the role of the kidney in the control of the blood pressure. So with this we start our discussion about the control, about the role of the renal, about the control mechanism of the blood pressure and the role of the kidney in that. It involves the water reabsorption, which is carried out with the assistance of the different hormones, aldosterone, vasopressin, the other name is ADH. Sodium retention, because that is also affected by the aldosterone. An increase in renal output, decrease in the venous return and arterial pressure, increase in extracellular volume without compensation from the kidney while the blood pressure is high. Now this is just a few words about the role. I am going to discuss all these things in detail now. What is the role of different hormones, how these mechanisms they are carried out, and how the water absorption, reabsorption is going accordingly with the fluid compartment, and affecting the volume of our fluid compartment and ultimately affecting the blood pressure. For that, I have already told you that blood pressure is one thing which goes with the other thing which is equally important, and that is the volume of the fluid compartment. So blood volume and blood pressure, I should say the volume of whole of the fluid compartment, that are going with each other, they should be in balance. If one of them is disturbed, it is going to give an harm to the body. It is going to affect the net result, that is blood pressure. If the volume increase or if the volume decrease, in both conditions it will affect the blood pressure. If the volume remains same and blood pressure that increases or decreases, again balance of these two characteristics, that is very important. They affect equally to each other. So the volume of the fluid compartment, that should be in normal range, that should be kept in normal range, also with the normal range of the blood pressure. That is the ideal. If any one of them is going to be changed, either the high or the low, whole story that will be disturbed. If the blood pressure increases, if the blood pressure decreases, kidney act through the renin-angiotensin mechanism. This is the topic which I will discuss in the next video. In the today's, I am going to focus how the high blood pressure that is going to give harm to our body, and how the kidneys they are going to control the high blood pressure. So if the blood pressure increases, the kidney is affecting both of these parameters, that are the volume of the fluid compartment and also the osmolality and the pressure, ultimately the pressure. To control the volume of the fluid compartment, we have the pressure diuresis, and for the control of the sodium, which is going to affect ultimately the blood pressure, that is through the pressure natriuresis. What are these things? We will discuss in following slides. I will discuss these things, how it is carried out, what is the mechanism. But here you must appreciate this thing, that kidney is going to control both of the parameters, or I should say it is affecting the fluid compartment also, and through different ions, especially the sodium ion, it is affecting the blood pressure. So if the blood pressure increases or decreases, it increase or decrease the sodium concentration of the blood to via its excretion or reabsorption. If our body needs sodium, it increases its reabsorption. If our body don't need sodium, it increases sodium excretion. That's why that is the mechanism through which it is going to affect ultimately the blood pressure of our body. Slowly and steadily, I am coming to the topic how and what are the mechanisms involved through which the kidney is going to control the blood pressure. So, whenever the blood pressure increases, the kidneys excrete the increased quantities of sodium and water because of the pressure natriuresis and pressure diuresis respectively. As a result of the increased renal excretion, the extracellular fluid volume and blood volume both decrease until blood pressure returns to normal and the kidneys excrete normal amounts of the sodium and water. While as I have already shown you in the previous slide, I repeat it. Uh, this one. When the blood pressure decreases, when the arterial pressure falls too low, the kidneys reduce their rate of sodium and water excretion. Over a period of hours to days, if the person drinks enough water and eats enough salt to increase the blood volume, the arterial pressure returns to its previous level. Sometimes it requires many days or week. We should say that it can occur within days, or it may require some week also. And it is not a major importance in the acute control of the arterial pressure, but it is included in the long-term control of the arterial pressure. The main mechanism which is involved, that is the renin-angiotensin mechanism. Regarding the high blood pressure, coming to this slide again. Now, regarding the pressure diuresis, I would like to show you this very important graph, which is going to show you that how the arterial pressure and the urine volume output that is related with each other. You can see that with the increase in the arterial pressure, you can see the urinary volume output that also increases. Pressure increases, urine output increases, and that is called the pressure diuresis. In this graph, I am just showing the relationship of the arterial pressure with the urinary volume output. Whenever the arterial pressure increases, kidney increase output of water and salt, pressure diuresis and natriuresis so that there is decrease in the blood volume, decrease in the cardiac output, and ultimately the arterial pressure returns to the normal. Previously, I have told you that you can, while discussing what are the pressure, um, what are the important pressure related to the fluid compartment or the blood inside the blood vessel. We have the hydrostatic pressure and oncotic pressure, osmotic pressure. In that topic, I have told you that it is better that you should assume it as solute and solvent. So, what is the concentration of the solute and what is the solvent? And here we have the solvent water. While discussing that topic, I told you that solute, if the particle solute, they are less, as we have the plasma protein. If they move outside, they drag water. If they are more inside the blood vessel, they kept water with it more as compared to the outside. Same is happening here for the sodium ions, that it drag water also. That is called the pressure natriuresis because of the sodium. If the pressure is high, blood pressure is high, that has excessive sodium also, so it through the kidney it must be excreted out, and while going out of the body it drag water, which is called the natriuresis. And because it occurs because of the increase in the arterial pressure, so that's why we are going to label it pressure natriuresis. This word natriuresis, this thing that is showing the sodium ion concentration, as it is occurring in response to the arterial pressure. That's why we are going to label it pressure here. Uresis, which means excessive urine formation. This is the excessive urine formation, excretion of more and more urine, more fluid compartment from the fluid compartment of your body under the effect of high pressure. So this is the pressure diuresis and pressure natriuresis. Slowly I will tell you the more detail of all these things. Previously I have shown you that just the relationship of urine output and blood pressure. Now here's some more things. I want to show you the solute concentration also, or the water and salt intake is affecting all these things. If we keep this thing, that is the water and salt intake, this is the fixed water and salt intake here. With that, we are going to show you the relationship of the arterial pressure with the intake or output of the urine here. How it is related. If the pressure increases, what will be the effect? So the first part, it shows the effect of various arterial pressure on urine volume output by an isolated kidney, and not only showing the output of the volume but also the pressure natriuresis, that is the sodium ion concentration. So long as the arterial pressure is above the normal equilibrium point, renal output exceeds the intake of salt and water, resulting in a progressive decline in extracellular fluid volume. While on the other side, if the pressure decreases below the equilibrium, how the kidney acts, the renal output of water and salt is lower than the intake, resulting in a progressive increase in extracellular fluid compartment. The only point on the curve at which a balance between the renal output and intake of salt and water can occur is the normal arterial pressure, that is the equilibrium point. You can see this one. So with the normal blood pressure, if we fix this one, that is the water and salt intake, how the kidney role is participating here, that is this one. But if what happens if the increase in the pressure take place while we have the fix this intake of the water and salt, how the kidney is behaving, you can see at this point. If you go up and here and now you follow this one, that is the kidney, through the kidney almost the 3 times excretion that take place, that is to cover the elevated pressure. We have the pressure diuresis and pressure natriuresis. I repeat it. It is the normal. This is a somewhat complex graph. Because of that, I have shown you previously just simple graph so that you should understand easily this one. Here, if the pressure is within normal range, we can have this one almost here, the urine output. With the increased pressure, as I have already told you, we have pressure diuresis and pressure natriuresis. Only in that condition we can have the normal here. Otherwise, we will our body will face hypertension. To avoid that, the kidney must have the pressure diuresis and pressure natriuresis. For that one, you should follow this one at this point, that is that high pressure. What is the urine output? It is going here, and this one is the 3 times almost here. So that in that case, and if the pressure decreases, you can check here, the urine output also decreases. It reaches here. If the pressure is going in this direction, the urine output is becoming less and less. If you are going above that in this direction, the urine output is also increasing, so that you have the pressure diuresis and pressure natriuresis. The body loses fluid, blood volume decreases. In that way, the blood pressure also decreases. Furthermore, this loss of fluid does not cease until the arterial pressure decreases to the exact equilibrium point. With that, if the blood pressure falls below the equilibrium point, you are going in this direction. What happens? The kidney decreases the salt and water excretion to a level below the intake. I have shown you this line, that is the fixed intake for the salt and water. If the pressure goes beyond, go below that one, below the normal range, what happens? The excretion of the this one, that also decreases, causing accumulation of the fluid, that is the conservation of the fluid to increase the fluid compartment, and also the conservation of the sodium, which is going to increase the blood pressure, or I should say to compensate the blood pressure. Because there is no remaining error in arterial pressure after full correction, this feedback mechanism or this feedback system has infinite gain. Now coming to this one, that is the arterial pressure control near the infinite feedback gain. The return of the arterial pressure always back to the equilibrium point is the near infinite feedback gain principle for control of arterial pressure by the renal body fluid mechanism, which I have already explained. So this is the rule that if your body, if the blood pressure is increased, excretion through the kidney for the fluid compartment for the sodium, that also increases. If the pressure decreases, the opposite effect through the kidney that take place, conservation of water with the conservation of the sodium that take place. Because of all these mechanisms, the blood pressure that is kept within the normal range. If in any condition this is exceed, this limit is exceeded, then what happens? The patient may go into the shock condition or in the hypertension. If the blood pressure is too high, which cross this limit of the kidney, the hypertension is the net result. If there is an excessive decrease in the blood pressure, the patient will face or patient will have the shock condition. So in this way, the kidneys, they are going to manage the both of the sides, either the high blood pressure or the low blood pressure. Mainly, we can say the determinants of the long-term arterial pressure level that are two: renal output of salt and water, and what is the intake of the salt and water. How much you are taking the water and salt, that is what is the intake, and how much the output. And I am mentioning here especially the renal output, because we can have the salt output through the sweat or salt and water through other sources, for example sweat or feces and like that. So omitting all these things, we are going to discuss here only just the role of the kidney, how they are going to participate in the control of the blood pressure by managing the renal excretion of the salt and water. Now the question is, what are the factors that increase the blood pressure? That is increase in the blood volume, which increases cardiac output. I have already told you that the blood pressure is not only the pressure which is present in the blood vessel, but it is also affected by different factors, among which the most important is the volume of the fluid compartment. So if there is increase in the blood volume, ultimately it will increase the cardiac output. Increase in the total peripheral resistance, increase in the blood pressure. Vasoconstriction cause increased blood pressure, while the opposite, that is the vasodilation, that will cause the decrease in the blood pressure. So if there is increase in the total peripheral resistance, it will increase the blood pressure. Ultimately, we can have the loss of the salt and water through the kidneys. To balance this increase in the blood pressure. Again, I am saying repeatedly that I will go in more detail of the mechanisms involved in the control of the salt and water excretion and conservation. In the third thing, that is the increase in salt intake. These salts cannot be excreted easily. That will increase the blood pressure due to the increased osmolarity stimulates thirst center and increased secretion of ADH from posterior pituitary, increased reabsorption of the water. I will show you very nice pictures also, and very elaborated sketch for this mechanism in the following slides. But here I'm giving you the summary, that is the increase in the salt intake. And please apply all these things on human body. It is your experience that if the blood pressure is going to be decreased, maybe of your colleague also during hypertension or any specific condition, we advise usually to have egg and sprinkled salt over that one, or just take the saline water to drink, or the saline drip is infused to increase the blood pressure. I'm just mentioning how the increase in the salt intake, that is going to increase the blood pressure. As you are going to increase the sodium concentration in the blood, that increases the blood pressure, so that the osmolality that is changed, high osmolality, because the high concentration of the sodium that increases the blood pressure. Once this is achieved, when this happens, a special type of the center which is called the thirst center present in the brain, that is stimulated, and ultimately to balance that one, you feel thirst and you drink water. But before that, there is slight increase in the blood pressure. This thing we are discussing our internal mechanisms, and again I am saying you that when you exceed these mechanisms, ultimately you will develop the special conditions, hypertension. And the second thing, that is the increased secretion of ADH. What is that one? Antidiuretic hormone. From the posterior pituitary, increased absorption of water take place, again to balance the excessive sodium ion concentration in the blood. And we will discuss this in the following slides also. Two ways in which the arterial pressure can be increased: either by shifting the renal output curve in the right hand direction towards a higher pressure level, or by increasing the intake level of the salt and water, which we have discussed here just now. So this is the two way in which the arterial pressure that can be increased. Just I want to say that again the same thing, the fluid compartment and the pressure, they are going with each other. If you change one of them, ultimately the second thing that is also going to be changed, that is also going to be affected by the change of the first one. And this is shown here, that either by shifting the renal output curve in the right hand, this one, this is the way when you are fixing this one. Otherwise you have this intake is fixed, pressure is high. Otherwise you can have this one. So it is in this here we are going to show the normal thing, this one. If the pressure increases, ultimately we have the renal response, that is urine output, that is increased much more, 3-4 times as the normal or previous. This is the only solution to balance the increase in the blood pressure, or to compensate that one. If that is fixed, output is fixed, ultimately the pressure will be increased, remain increase. So second thing, that is by increasing the intake level of the salt and water, that is the second option. I think it will be clear now. Failure of the increased total peripheral resistance to elevate the long-term level of arterial pressure if fluid intake and renal function do not change. through this one, I am going to show you that how the failure of the to increase total peripheral vascular resistance elevate the long-term arterial pressure. When total peripheral vascular resistance actually increase, the arterial pressure increases almost immediately. If the vascular resistance of the kidneys is not increased and they continue to function normally as such as their routine is or previously, the acute rise in the arterial pressure is not maintained. The reason is that increasing resistance everywhere in the body except in the kidney does not change the equilibrium point for blood pressure as dictated by the renal output curve. With increased peripheral resistance and arterial pressure, the kidney undergo pressure diuresis and pressure natriuresis, causing loss of salt and water from the body. And I am again and again saying the same thing. And this loss continues until the arterial pressure returns to the normal equilibrium point. In many cases, when total peripheral resistance increases, the renal vasculature also increases. This causes hypertension by shifting the renal function curve to the high blood pressure. Now come to the next one. This one, through which a very nice sketch how the fluid compartment is going to affect the blood pressure. And this type is called the volume overload hypertension, or increase in the pressure due to the increased volume of the fluid compartment. Whenever there is increased extracellular fluid increase in the extracellular fluid compartment, increased blood volume take place, which increases the mean circulatory filling pressure, increase venous return to the blood to the heart, and increase cardiac output. As we have increased venous return, ultimately it increases the cardiac output. At this stage, we have the two mechanisms, either going through this mechanism or directly increasing the arterial pressure. If there is increase in the cardiac output, there is a direct increase in the arterial pressure, or maybe through the increased total peripheral resistance, ultimately going to increase the arterial pressure. At this stage, to balance this one, increased urine output take place, and through this, again I am saying the same thing, pressure diuresis. Through this we have this negative effect, and that is balance, as the kidney they are going to excrete more and more fluid, so that this increased extracellular fluid volume that is kept normal, or this increase is now decreased. Because of whole of this story, it is going to affect the kidneys. Ultimately, the kidney is going to control the blood pressure through the excessive increase or excessive excretion of the fluid. What is the importance of salt in renal body fluid for arterial regulation? This is the pressure natriuresis. When there is excessive salt in extracellular fluid compartment, the osmolality increases and stimulates the thirst center, ultimately leading to an increase in excessive extracellular fluid compartment or volume. Increase in osmolality stimulates the release of ADH, also leading to the retention of the fluid and increase extracellular fluid volume. For that, I should show you a very nice picture, this one, which I have already In previous video I have already added this one, but here I added again to show how the blood water concentration it is going to affect the blood pressure, and how from the brain, what is the role of the brain here, and how here the hormone is secreted from the adrenal gland, and what is the role of the kidney. All these they are mentioned in one animation, very nice. Here how the increase in the water uptake and increase water reabsorption through this one, and we have the renin angiotensin mechanism, aldosterone secretion which is going to act on the kidney, and that is ultimately affecting the whole fluid compartment also. The role of the hypothalamus osmoreceptors detect high solute concentration. Osmoreceptor they are present in the brain, which are specifically detecting the concentration of the or the volume of the fluid compartment, and they are sending impulses to the adrenal gland and ultimately to the kidney to control that one, to control the fluid compartment. Again, the more detailed that is this one, and come to later on. Before that, I want to show you what are the osmoreceptors, where they are located. This is the location of osmoreceptor. As their name shows, they are very much specific for the water or fluid compartment. What is the osmolality of the blood? They are going to detect that one. And from where they are getting the input, baroreceptors, chemoreceptors, they are going to affect these also. And this whole thing that is present in the hypothalamus here, close to the pituitary, here we have, this is the pituitary gland, anterior posterior pituitary gland. Here over that we have the hypothalamus, in which we have the supraoptic and paraventricular neurons. Close to that we have these osmoreceptors. So they are going specifically, they are going to detect the osmolality of the blood. Other receptors like baroreceptor, chemoreceptor, they are also coming to the same neurons, and all information from all of the body that is reaching here through all these sources. Now they are going to affect the posterior pituitary to release the ADH, antidiuretic hormone. This hormone is either released or not released. That is the information that depends upon the information which is carried out, which is coming through this receptor. So if the osmolality increased in the body or it is decreased, it depends that either the ADH that will be secreted or it will not be secreted. It depends upon whenever it is secreted, it is antidiuretic hormone. That is, it is going to inhibit the diuresis. It is going to conserve the water. It is going to conserve the fluids of the body. If your body needs fluid, ADH will be secreted in this through this mechanism to conserve the water. If your body don't need, that is, you need now the pressure diuresis, this is inhibited, and there will be increase in the urine output. So this is the again I'm saying repeatedly that this is not so easy. I am trying to explain all these mechanisms to my full extent, but I cannot explain completely, as this is somewhat beyond your level, because it involves the much more comprehensive role of the kidney, but to some extent you can understand it. So how the ADH is synthesized and from where it is released in what is the role of that one, and how it is going to affect the renal tubules, kidney tubules. This is the explanation, or this is the mechanism. Whenever there is decrease in the fluid compartment, for example, the patient have vomiting or diarrhea, that leads to the deficit of the water in the body. What happens? Increase in the extracellular osmolality that take place. Ultimately, it is going to stimulate the osmoreceptors to increase the ADH secretion from the posterior pituitary. Okay, then the plasma ADH increases through plasma, through the blood. It reaches to act on the kidney tubules, water permeability in the distal tubules, or you just say the kidney, through that one the water permeability that increases simply, so that more and more water reabsorption take place, conservation of water take place, so that it has this one negative effect on that one, so that the water deficit that is going to be balanced through this mechanism, through the kidneys, and so that the water deficit is removed. Osmoreceptor antidiuretic are a feedback mechanism for regulating extracellular fluid osmolality in response to the water deficit, that is shown here. So this is somewhat something about the role of the kidney. In the next, I will focus the renin-angiotensin mechanism. I will also tell you the role of the aldosterone also, again, which is going to affect the sodium concentration. So it is not the end, but just you can say that it is the introduction of all these things, and this topic that will be continued in the next video also. And after that we will have very few or very little concept about the control of the blood pressure, because as it is very much complex. Okay, thank you very much, and with this we ends here. Thank you. Allah Hafiz.